All right, thank you, Greg. You know, we hear a lot about breast implants all the time, but there are many women who actually have a large bra size and find it a burden. They suffer with back pain, and it's difficult to exercise comfortably. Finding clothes that fit is just about impossible. For these women, breast reduction surgery can be the solution they're looking for. Angelique Hobbs is a 24-year-old student, a single mom to her son Antonio, and she wants smaller breasts.
I'm having it done because I'm very large for my size. It's always been a problem. I've always been larger than most girls in my class. It's very hard, especially with dealing with people who don't know how to look you in the eye. And they're just pretty much looking in other ways instead of at your face.
In a culture obsessed with women's breasts, you don't get a lot of sympathy if you're the woman who wants to make hers smaller.
The first thing they say is, why don't you carry these around for a while?
Dr. Emily Pollard is a board-certified plastic surgeon in Bala Cynwyd, Pennsylvania. Women from their teens to their 70s come to Dr. Pollard for breast reduction surgery.
Angelique is 4'11". She's a tiny person. And we don't want her to be shaped like an upside-down triangle. Everyone wants to eventually get to some sort of hourglass figure. And so that's our goal, to make you more in proportion to you.
This surgery will take Angelique from a double D cup down to a more comfortable C. First, the nipple has to be moved up, and Dr. Pollard uses a lollipop incision to minimize scarring.
During the course of the breast reduction, the nipple is actually left attached to the underlying breast tissue. So all the mechanics are still there. The breast tissue attached to the ducts, attached to the nipple. That's all in place. And all the reduction is done around that. It's not so much how much you take off, it's how much you leave. You want to make sure that you're as symmetrical as possible. Another concern, though, that they have is whether or not they're going to lose sensation in the nipple area. And again, it's our goal to maintain that, the nerves and the arteries and veins going to the nipples so that they do not lose their sensation.
Are you going to open your eyes, Angelique? Hi there. Surgery's all done. Oh, big smile. Oh, you're welcome. You're welcome. Oh, my goodness, she's awake. Yeah, open your eyes.
1 year later, and Angelique is a brand new graduate with a brand new figure.
I can wear everything now. Before I couldn't wear anything, and now I can wear all kinds of little shirts. You know, I feel a lot better now, just inside and out.
We're at Bella Sunai in Philadelphia. Shop owner Shanice Jenkins has a few suggestions for Angelique's new wardrobe.
It'll look really good on you, I think.
She's doing really well. She's back to her activities, able to exercise actually, because now her back and shoulders don't hurt so much.
Ladies and gentlemen, she's coming.
In the past, they've been advised by either their pediatrician, their gynecologist, or their family doctor to wait until after they have children. But I say if you're having the problems, if you have pain in your back and shoulders, and you have rashes and everything, then you need to have that addressed.
Cool. Do it again.
Every one of them says, I wish I had done this sooner.
Beautiful dress. Thank you.
And I really need it. Give me a picture.
I really am.
Okay.
Very happy. Wouldn't change it for the world. I wouldn't.
Looks like the whole family's happy. Dr. Pollard says that there are all kinds of misconceptions about this surgery, that it's extremely painful. It is not. That you'll lose sensation. Most people will not. She also says that if you're thinking about having the procedure done, it's important to get your information from a plastic surgeon, not from the grapevine or the internet. Really talk to a doctor. And a fun little side note for you, Dr. Pollard also pierced Oprah Winfrey's ears. Just a little casual conversation sidebar.
Oh, is that right?
Isn't that fun?
Now, I wonder, does insurance cover this?
It depends. Really, you do have to talk to your insurance provider to find out. But for a lot of women, they do have to have a reduction. My sister actually had to have a breast reduction in high school because she could not play basketball. She couldn't be on the team anymore because it was literally cutting her shoulder blades. Yeah, from having the.
So depending on the circumstances, your insurance company may provide you, may cover that, which is of course good.
Yeah.
All right.